Good afternoon, and thank you for tuning in. It's great to be part of a conference that is so dedicated to advancements in alcohol policy. My name is Alicia Sparks, and I am the Vice Chair of the U.S. Alcohol Policy Alliance and a Senior Scientist at Abt Associates. I know you've all heard a lot about the effects of COVID-19 on alcohol policy, including the deregulation efforts being pushed by the alcohol industry and the efforts our field have taken to push back. I'm going to provide an overview of why it's so important that we continue to push back. And I wish we were all in person today, but please bear with me as I try to do technology here. I just recorded this entire thing on mute, so hoping this one goes a little bit better. So you've likely seen some of the data that I'm going to present here now throughout this conference, but I wanted to briefly summarize some of the key studies, put it all in one place, and learn a little bit more about how alcohol use has changed over the past year and a half. So one of the first pieces of information we saw come out about the effect of the pandemic on alcohol use came from Nielsen sales data. They analyzed alcohol sales for a week in March and compared 2019 and compared that to the same week in March of 2020. And they found some pretty substantial increases. So as you can see here, overall in-person sales increased by 50% in March 2020 compared to that same week a year before. And these numbers were higher, for wine and spirits. So you can see here that spirits alone, sales increased 75%. And particularly alarming in the context of deregulation is the increase in online alcohol sales, which saw a 243% increase in the beginning of the pandemic compared to the year before. And so as we think about these sale increases in the first, really few weeks of the lockdown that many people have experienced, and we're seeing rises in spirits and online sales, this has pretty direct implications for the way that alcohol policy has changed over the past year and a half, and things as we think about things like delivery of alcohol to people's homes. So home delivery, either directly from a retailer or from ordering it online and having it shipped to the consumers. Recent attempts to try to allow alcohol to be shipped through the USPS. And even things like cocktails to go, as people are able to go in, purchase their spirits and go home, whether it's as a cocktail or from a grocery store picking up a bottle of liquor. A recent study provided more detail about how much people were drinking in 2019 compared to 2020. So in 2019, the baseline number of days when alcohol was consumed each month on average was about 5.5. So in general, people drank some sort of alcohol, some amount of alcohol, about 5.5 days a month in 2019. In 2020, this increased to 6.25 days a month. So this was a 14% increased consumption overall just between the 2019 and 2020. And so on this slide, you can see some of the populations that reported significant increases in consumption. So if you look carefully here, you can see that among non-Hispanic whites, there was a 10% increase in consumption. And if you look at age, you see that those between the ages of 30 and 49 report drinking almost a full day more in 2020 than in 2019. But I'm also watching the rates of women particularly closely, as overall in the past 5 or 10 years, we've seen the rates of binge and heavy drinking among women rise to the same level as men, when historically there was a pretty large gap. So now that gap is closing. And the data presented here suggests that women increased their drinking more than men did during the pandemic. So you can see the 17% increase in drinking among women specifically. And so thinking more about women, not only did they drink more in general, so report more drinking days, but they also reported more frequent heavy drinking in 2020 compared to 2019. So the study that I've been talking about for the past 2 slides found that 20% of women reported heavy drinking an additional day per month in 2020 compared to 2019. So again, they are now heavy drinking another day each month, 1 in 5 women. And when the study analyzed all these different demographics, the only group that has significant increase in heavy drinking was women. So again, we're seeing these harms by a specific group of population who seems to be differently affected potentially by the pandemic, and their drinking rates are much higher. So another survey looked at changes in alcohol use in the first month of quarantine and found that nearly 1 in 5 adults reported drinking more in March than in the months before that. So similar to the previous study I just showed, the adult age population seemed to be drinking more than young or older adults. with 25% of millennials drinking more and 20% of Gen Xers saying that they consume more in that March 2020 than they had in previous months. And in case you're like me and had to look up what a millennial was, what a Gen Xer was, a millennial is considered those who are currently between the ages of 24 and 39, and Gen X is the next generation, so 40 to 55. So these data match up with the previous study that showed increases among those 30 to 59 specifically. I also want to briefly show what's happening in the US is not unique. So if you're just glancing at the slide, I do want you to note that some of the data are presented in use, so how much people are reporting their drinking, some are in sales, how much people are buying. Like the US, many countries are still collecting survey and consumption data to better understand changes in consumption patterns during the pandemic. So these measures are not directly comparable. So don't try to compare across states or across countries. I just want to give you a flavor of what we're seeing here. So you can see that there are pretty substantial increases in drinking and alcohol sales around the world. So alcohol rates are rising everywhere. And as we've seen deregulation happening everywhere, none of this is particularly surprising, I would say. But you do see, between a 20% into 14% sales or increase in use and up to a 31% increase in sales in the UK. So studies and surveys have found a number of reasons why people report drinking more during the pandemic. And most of the surveys to date have found primarily factors that affect individuals, such as a loss of individual, managing children who are no longer in school or daycare, a loss of their social networks due to quarantining and social distancing, and people feeling sad or depressed. So while there's no doubt these are contributing factors, and that's very clear that they are, we know from robust literature that the environment really matters. And so that the increased accessibility and availability of alcohol is strongly associated with increased use. So we need to better understand what the relationship is between the increased availability of alcohol as a result of the policies changed during COVID-19. Again, things like alcohol to go, home delivery, shipping through the mail. So the effect of these changes on increases in alcohol during and after the pandemic. So these factors are really critical, and now we need to think environmentally as well. Fortunately, there was a survey of adults in May 2020 that asked explicitly about whether the change in alcohol was a contributor to their changes in alcohol use. So the survey found that in May of 2020, so again, a few months after quarantine, 60% of adults reported drinking more, while only 13% reported drinking less. So 2/3 of adults in the survey drank more, 13% drank less. So pretty large difference there. And similar to the studies that we talked about on the previous slide, stress and boredom were both associated with increases in drinking. But the study explicitly asks about whether the changes in availability of alcohol was a factor. And interestingly, both those who cited more drinking and those who cited less drinking, reported more and less drinking, noted that availability influenced their behavior. So not only was the increased availability of alcohol related to increases in drinking, so you can see here that a third of those who reported drinking more said that the increased availability of alcohol was a factor for them. But among those who reported drinking less, the diminished availability of alcohol was the leading factor for them and why they were drinking less. So nearly 2/3 of this population said, I'm drinking less because it was harder for me to get alcohol. So this survey supports the research that shows that the more alcohol is available, the more people drink. And when you reduce the amount of alcohol available, it serves as a protective factor to reduce consumption. So as we're seeing these trends emerge, it's important to think about the myriad of factors that could be influencing consumption, including things like availability and accessibility, as we're seeing those change through these different policy options. So reducing drinking rates is really important due to the harms associated with consumption. So we've talked a bit about some of the different trends we're seeing, but let's think a little bit about the harms that are related to alcohol emerging explicitly during COVID-19. So we know there's a huge body of literature out there about the number of harms associated with alcohol use, including things like cancer, violence, driving under the influence, liver disease. I can go on and on, but I want to talk more about what we're seeing specifically during COVID-19. And while these data are fairly new, because it takes a while to collect and understand changes as a result of these types of worlds, pandemics. There are a few things that are out there, and we're able to draw upon a broader body of work. So I just want to briefly touch on some of these. So I've lost my place. Reducing. So as we've talked about with women, we did see heavy rates of drinking or drinks. We saw rates of drinking and heavy drinking increase among women between 2019 and 2020. We also saw that their harms were increasing. So there was a 39% increase in harms experienced by women as a result of their drinking in 2020 compared to 2019. So a 40% increase in a year in women saying that that they feel guilty or shamed after they drink or take foolish risks when they drink, or they fail to do what's expected of them when they're drinking. And these findings show increased alcohol-related problems independent of consumption level for nearly 1 in 10 women. So regardless of how much these women drank, their harms associated with alcohol use increased between 2019 and 2020. So again, there's a complicated factor going on here with women that need to be explored more deeply as we're seeing consumption increase, but also harms increase regardless of consumption levels. Now, this slide's not the prettiest slide, but I did want to briefly touch on hospitalizations. So there's some data emerging around hospitalizations related to alcohol use during the pandemic. And one study in the Midwest looked at 750,000 hospitalizations within a month of the stay-at-home orders taking place. And among those who went to the emergency department specifically for a behavioral health concern, so substance use or mental health, so among that proportion of folks who went to the emergency department, there was an increase from 28 to 33% for those that explicitly involved alcohol. So again, in the month after stay-at-home orders went into place, there was a five-point increase in the number of people who went to the emergency department for an alcohol-related issue. Now, it's likely that these are underreported because of the way that alcohol incidents are tracked in emergency departments, and because folks are probably going to the emergency department less during COVID-19. But even holding that true, we are seeing this increase between 2019 and 2020 in how many folks are going to the hospital with an alcohol-related incident. And so data like these just help contribute to our understanding of the broader set of harms that are happening related to alcohol during the pandemic. We've also seen spikes in consultations for alcohol-related liver disease and hepatitis, and these are outcomes that we usually consider longer term, but seem to be coming up sooner than we expect. And so I'm just, again, keeping track of this as we think about what's happening during the pandemic. And so you can see here that there's a 60% increase in the proportion of people who went to see a doctor for an alcohol-related gastrointestinal or liver disease issue, and 53% in those who went for alcohol-related hepatitis. So again, holding all things equal, we are seeing these increases during the pandemic that were not there before. But it's also really important to consider the wide range of societal harms that we know are associated with alcohol use, but the data are still emerging as it relates to COVID-19. And I'm just picking 3 here because I think that they're of particular concern given the quarantining and the stay-at-home orders that are present with COVID-19. So intimate partner violence and child abuse are of particular concern. Partners and children are particularly high risk of abuse during COVID-19 due to these reports and increases in alcohol consumption that we've seen in this country and around the world, but also because people are stuck at home and they don't have their accesses to service and the supports necessary in instances of violence. There's also a similar situation in the case of suicide. So we know that suicide is associated with alcohol use. And as people are drinking more, they lack the ability to go seek support. They lack their social ties. They lack their social networks, given the stay-at-home orders. So we need to do some additional research here to better understand what's being done to further explore the relationship between alcohol, these specific harms, and the pandemic. So these data seem a little bit depressing, especially when you think about them in the context of everything else you've heard around the alcohol industry's efforts to make alcohol increasingly accessible and available. But we have reasons to be optimistic. The challenges in the last 18 months have served as an impetus for the alcohol prevention field, to come together and start fighting back in a more cohesive and organized way. So there's a large body of literature available on the strategies and interventions that the public health field can work on to implement some implement to combat some of these trends. You've heard about a lot of these strategies throughout this conference. You've probably heard them before. And so today I want to talk more about how to build a movement and organize within your organization, your community, or your state to begin or continue the process of implementing alcohol policy. And it's important to note that this is really just the first step along the way of policy passage implementation, but it's a really critical one that can't be left out. So I'm going to be talking about 4 key ways in which we can come together. The first step is to do an assessment of who you can connect with. The second is to start to build those relationships and networks based on the assessment you did in step 1. And then build capacity both internally and externally to do the work. And finally, really start coming together to mobilize for change. So I'm going to be talking about this briefly. There's a ton of information out there that can help with each and every one of these steps, but I wanted to provide an overview of some of the things I've been thinking about over the past year and a half and some examples that I've seen of how this has really come together. So the first is finding your partners. So this is really thinking about who is already doing the work that you're doing or you're interested in or that you're hoping to go in that direction. And I would consider both individuals and organizations. Obviously, organizations might have broader capacity, might have more resources, but really importantly, individuals often have a commitment for this work and a passion for this that's incredibly helpful when trying to move policy forward. We should also think about partners that might be unconventional or unexpected. And I'm going to talk more about this in the next slide. But beyond thinking about your usual health departments or nonprofits or coalitions, there's a whole host of other individuals and entities that could be really good partners here. So you should definitely be trying to think about engaging with these who have listed here. You know, there's coalitions in so many communities who are working on these issues, who are focused on substance use. Law enforcement is regularly trying to reduce the number of harms related with alcohol use. And so figuring out how to partner with these organizations is incredibly valuable in a first step, but also thinking a little bit broader. We'll talk about that in a moment. And part of finding partners is deciding what disagreements you're okay with. You know, part of the alcohol policy field is finding unlikely bedfellows. It's thinking about who you can work with, who you might align really well on these issues, but have differences of opinions on others. And as an organization or as an individual, you need to be thinking about, you know, what you're okay with saying, you and I don't see eye to eye on this, but we really can come together and make a big change on policy, and which you're not. And I just think that's a really important thing to be considering as you're thinking about who you're partnering with and how you're building your networks. And then seek existing coalitions or networks. So find those out there who are already doing this work. You know, it's not particularly helpful to have 2 different organizations moving in the same direction on parallel tracks without some level of coordination and collaboration. And so I really encourage folks to see if there's already folks out there who have started this process and who have built their networks, and you can join them and help make it stronger, bigger, add numbers to that work. So this is one of the most exciting things I think I've seen over the past few years is the broadening of the tent. And so instead of, you know, just substance use prevention people coming together and doing substance use prevention or alcohol policy, I've seen this rededication and emphasis on seeking partners across the continuum from prevention, treatment, and recovery, and helping everyone see the importance and value of upstream prevention in affecting this longer term of people who need a treatment, people who are in recoveries from alcohol or other drug use. And so really making sure that we're bringing in all the folks who are dedicated to this issue across that continuum is really valuable and opens the door to a whole host of organizations and individuals who are passionate and dedicated to this issue. But then beyond substance use, there are so many organizations who do or should care about alcohol. And I think one of the things that we can do is help bring them into our work and help them understand why we're doing what we're doing and why they should care. So I've just listed a few here, and there are so many more in communities that folks should be looking out for, thinking about schools, hospitals, you know, there's a whole list here, but things like cancer organization, you know, which exists in so many different communities. We know that alcohol is associated with 7 different types of cancer, but not all cancer organizations know that. And so coming to them and saying, we care about preventing alcohol use and we care about cancer, and there's an association there. So if we're able to reduce alcohol use, we can also help reduce the incidence of cancer. make that link for them, help draw them in, and help them see why these policies and environmental strategies that we're encouraging will really help them, and why increasing availability and accessibility of alcohol has the potential to harm the population that they're really trying to work on, or the cause that they're working on. And that's the same for all of these here. You know, we talked a little bit about intimate partner violence earlier, but if you think about groups that are working on neighborhood revitalization, for example, we know that there's a body of research out there that alcohol outlets, so for example, a liquor store in a community, might be associated with loitering, with violence, with trash, broken streetlights, you know, a whole host of things that a group who's really focused on empowering and revitalizing a neighborhood might be concerned about, but didn't make the connection back to how this particular liquor store is related to a broader issue around the density of alcohol outlets, for example, or how we can kind of work on these different establishments to make them better parts of the community. So making that connection for them, helping them see again how their work is tied into ours, how we can work together towards a common goal. It's going to broaden that tent, it's going to increase the number of folks who are interested, and it's going to provide access to a whole different set of resources, interests, lawmakers, and so much more. The faith community has been partnered with the alcohol prevention field for decades. So thinking about who in your community might, from the faith community, might be engaging in this issue is always really valuable. And then if you think about mental health, for example, it's a co-occurring, we often see co-occurrence of alcohol use and mental health conditions. And so making that link again, upstream factors can prevent alcohol use, which then can reduce some of the severity or incidence of mental health symptomology. Making that connections, broadening your tent, bringing them in together can really help build your network and your connections. So once you've made your connections and you've already kind of started building this out at the local level, it's also really valuable to think about whether there are national organizations that are in existence that you yourself or your organization can join, or you can bring your new bigger coalition together to be a part of. There are a number out there who are working on these issues, and it's always valuable to connect with them in order to be part of the national issues that are happening, but also they can connect with other folks who are doing similar work to what you're doing. But beyond thinking about just organizations that you can be partnering with or building relationships with, there's a lot of value in joining a campaign or a policy effort that contributes to the work that you're doing, but also helps further this other campaign. So as a brief example, you may have seen that recently the White House promoted a alcohol industry promotion around giving every American a beer or other beverage if the US hit 70% vaccination rate. It was a free opportunity for folks to sign up and receive alcohol seltzer or non-alcoholic beverage. And the White House promoted this on their website as part of their COVID-19 vaccination plan. So a group of us put together a response, put together a letter saying that we didn't think that the White House should be partnering with the alcohol industry. And we sent that out to our network. And we were able to get over 100 individuals and organizations to sign on to that. And we heard from folks we'd never heard of from before. And so all of a sudden we were connected to new people. They were connected to us. We recognized that they had similar concerns that we did around these issues, that they're working towards different but really effective policy opportunities. And it just opened the door for a new dialogue and a new set of individuals and organizations to be working on this issue that we had never heard of before. And so things like this are a really great opportunity for you to make yourself known and for you to learn about other organizations who are doing this work. And again, make your case for partnership, whether it's these national organizations, whether it's these campaigns. You know, why do you care about this? Why should you care about this? Why do I care about this? And how can we make that all come together to better build this network and move this work forward? And so once you have built your organization or your coalition or your community of folks working on this, whatever that may look like, it's really important to then think about how you build capacity. And so part of that is looking at what opportunities exist out there that might be free for more education or training on whether it's a skill set or a content area or a policy that you're trying to move forward, or how to even do that. The PTTCs are one example of a regional, it's a regional body focused on prevention. And they have a ton of great work. They have a ton of resources out there. And they're just one of many examples that are organizations or entities that operate at the state, local, regional level whose purpose is to provide resources and opportunities for folks to learn more about prevention and other issues like that. Webinars, if you are like me, you get an email all the time about other webinars that are happening around prevention, alcohol, substance use, deregulation, all of these issues. And this is one of those sort of unexpected outcomes that's positive from the pandemic, is that increasingly these events are being put on online. These webinars are being hosted. There's more of them as ways to connect with people. So there's just a wealth of information already out there and probably coming down the pipe that are focused on these issues that you can join and that are free. And they're often archived too. So there's no harm in Googling around and trying to find a webinar that you can hop on to learn more about and get some extra education and training that you may not have already had as a free mechanism. But I also think it's really important to think about if there are opportunities to pay for training and TA to help move this work forward. And I know that resources are always tight for so many of us. This is not a super well-funded field, but there's a lot of value in putting money towards this work specifically. And as I think about that, there's conferences. One day we'll be back in person, but even conferences like the one that we're all tuning into right now, they're a really great opportunity, not just to learn, through webinars or sessions like this, to hear it from experts and to hear from researchers and advocates and folks who have done this work before, but also to make these connections, to build these partnerships. You are in the room with people, whether that's virtually or physically, and you're hearing about folks who are doing the work, and you're seeing people, and you're seeing who's joining, and you're able to have these conversations, and somebody may ask a question that you have or anything like that. So these conferences are a really invaluable opportunity to run into people in the halls, have a conversation, and realize that you're both doing the same work and that you can work together on this. And so I really encourage, to the extent possible, when things are available again, to be attending conferences as much as you can, to be getting yourself out there and making these connections. And then one-on-one training in TA is truly invaluable. There are a lot of experts out there who are highly specialized in alcohol policy work. And when I say a lot, there's not that many, but they're really good. And it's worth paying them to come into your community and help you assess, what are your local conditions? What are the problems you're trying to combat? Who are the folks in your community that you may be able to pull together? Once you do that, how do you determine what your strategy is? And then how do you move that forward? And being able to get that really personalized one-on-one training in TA is going to allow you to move more quickly, more comprehensively towards that goal that you're reaching, which then you can feed back into these other networks and opportunities that we've been talking about throughout this session. So overall, it might sound corny, but I really think it's true that we are truly stronger together in this field. Coming together gives us an opportunity to learn and to share. So it's really bi-directional. We can share strategies that have worked or haven't worked for us. We can share some challenges that we're facing and see if people have examples of how they dealt with this. We can celebrate successes with each other. And I think there's a lot of value in that. Not only is it an opportunity for everyone to be really excited with you for something that has gone well or a policy you've been able to get passed, but also gives everyone else a little bit of hope that it can be done, and see an example of that and learn how you did it. And we can share resources that we're developing and materials. So, I frequently get emails saying, hey, do you have a fact sheet on alcohol and cancer that you can share? And if you're part of a kind of a connection, or you have a community, it's easy to ask for something or to provide something if you see that gap in the field. It's also a way to get help once you have built your network and built your community. Either there's access to experts within that community itself, or somebody has connections to somebody who you might need to talk to bring in to sort of deal with a specific challenge you're facing or learn a little bit more about a certain area. It's an opportunity to get feedback on resources that you're developing, to see either somebody already has something that you can build on, or you kind of want to see an example, or have someone glance at talking points that you're drafting. It's an opportunity for sounding boards outside of your own head or outside of, the 4 people who helped you come up with an idea, to get some additional feedback, bounce some ideas off folks, and continue to kind of build that idea and move forward. And as I talked about with that letter, it's an opportunity to build sign-ons and support for whatever issue you are dealing with, or help somebody else with an issue that they are dealing with. Policymakers, certainly it's helpful to have big numbers say, we oppose this or we support this, and to be able to show support from across the continuum of substance use and across these broader stakeholders who care about this issue will make a big difference in what you're trying to do. So these are just a few opportunities that I have seen come up over the past year and a half that I've been just really excited to see develop and move forward. And there are many more out there. So This is not a comprehensive list, but one thing is that the U.S. Alcohol Policy Alliance has started hosting a series of interactive dialogues where we bring together researchers and advocates to present on an issue. So we've done a couple on COVID-19, one on alcohol taxes, one on alcohol outlet density, and it's an opportunity to say, here's the research, and then for an advocate to say, here's how we took that research and moved policy forward in this field. And then from there, we go into breakout groups. So again, it's access to experts, it's a way to learn, but then it's a way to connect with others who are interested in this work, who are doing this work, dig a little bit deeper and learn from one another. And so this is an example of a free resource that people can use to learn, to train, to network, to build, to do all these things in order to then mobilize and move forward in their own work. Another is the Alcohol Action Network, which is it's a group of people that was born out of the pandemic and has really just grown and expanded from there. And I think there's now representation from nearly every state. So it's a bi-monthly opportunity for people to come together and learn about what's happening in the alcohol field. There's mini training sessions, there's breakout groups, depending on what people are working on. There's an opportunity for sharing of resources, for events, for all of these different opportunities. And so, it's twice a month, a chance to come together with your peers, network, build, learn, grow in a way that's happening, across the country. And then we've also seen an increase in the number of states who are putting together state-level alcohol policy alliances. So this is taking all of this work that's being done at the community level and building it up to the state level so that it's a bi-directional again. So it's all these local folks building up towards a state organization who can then disseminate information back across everyone who's working at the local level while raising issues to the state legislator at the state level, pushing back against some of this deregulation. And so we're seeing more and more states bring their folks together through everything we just talked about and form these alliances that can work locally at the state level and then come together to work nationally as well. So again, these are just 3 examples, but if any of them are interest to you, let me know. I'm happy to connect you with the relevant people. But it's really exciting to see this convergence of activity, of brain power, of all of this moving in a direction to help work on these issues together. So my take home from the past 32 or so minutes is that networking is really key. We need to be finding our partners. We need to be figuring out who they are. We need to be thinking outside the box so that we're broadening the tent, so that we're showing the alcohol industry and policymakers and everyone that we have a really strong force behind us and that we're all working together in order to protect public health and safety. So we went over a few of the different ways we can do that, but I just think it's really, really important that we are thinking collectively about mobilizing and organizing as a broader community and not just as a small kind of silo whose work is only on this issue. So broaden that tent, network, come together, fight together. And a quick shameless plug that an opportunity to learn more and do all of these things that we were talking about is the Alcohol Policy Conference. This is our 19th, and it will be happening, fingers crossed, in person next year. You can register now, it's available, and it's a really, really great opportunity to connect with typically over 300 others who are dedicated to this issue, researchers, advocates across the board, who are coming together to learn more and connect with other folks who are doing the work. And we do have a 1.5-day Advocate Institute held right before the conference where we talk much more about everything I presented today, but really thinking about building collective action, building power, building community, and how we need to build this field to continue moving in this direction through relationships and networking and capacity, just like we just talked about, but more articulately and in much more depth. So I recommend that to the extent you can, check out the conference, please come. It's a really, really phenomenal opportunity, and I promise you will leave inspired and excited to do the work you're doing already. So that was fast. I apologize for that, but I'm happy to connect with anyone. My email's here. If you want to learn more about the work that we do, there are links here. And I hope to be able to connect with you all on the live sessions, and feel free to reach out anytime. It's always exciting to see who's doing this work and how we can all kind of come together and collaborate. So thank you for all you're doing, and thanks for tuning in.